Hey guys, this is Stephanie with Empower Physical Therapy, and today we are interviewing Dr. Elovitz, and he has a really cool office, and really just wanted to sit down and hear his story about how he became a doctor and why he's doing what he's doing. So I'm really excited for you guys to meet him. So, Dr. Elovitz, tell us a little bit about yourself, like where you came from, why you became a doctor, all that good stuff that everyone likes to learn about.
Sure. Well, thanks for having me talk on your podcast today. I actually came to Texas for college. Came all the way from Sweet Home, Alabama, and ultimately went to UT Austin and met my wife to be there, and ultimately kind of kept me in Texas. So did my medical training, most of it here in Texas, a little bit in St. Louis. I've been in Dallas since probably about 2001. And with Baylor downtown for about 10 years, and was with Cooper Clinic for a few years. And then I started my own concierge practice called Private Health Dallas about 3.5-4 years ago.
Yeah.
So
why did you become a doctor? What was it about it that you that draws you to become a doctor?
Probably from very early on, I had a friend of the family that got sick when I was a little boy. And, it started off that I wanted to be a brain surgeon. He had a brain tumor. And I don't know, I think you're a few years younger than myself, but I don't know if you remember a show called St. Elsewhere.
Yeah.
But I used to watch that show and used to think how there was a Dr. Craig with his hands and that could be a surgeon one day. So it kind of evolved over time. So, from being a brain surgeon to a cardiothoracic surgeon, and ultimately I fell into internal medicine is where ultimately I decided to go. So it's been great. I love it.
Yeah, that's awesome. I mean, I think we all have our similar experiences with that, how we grew up in life and what we imagine ourselves doing as a kid. And, I originally wanted to be a doctor when I grew up because I played sports. I was a gymnast and I played soccer, and I was always in the doctor's office, always. But I was always a kid of like, why did this happen? How can I fix it? So landing into physical therapy actually fit my personality way better than being a doctor, because I love the whole journey of like seeing the patients and figuring out the puzzle of people, and then like seeing that journey through the whole entire time. Like that's my favorite part of physical therapy.
I love it. The journey is the best part.
Yeah, exactly. I mean, I learn from my patients all the time. Like the body is so amazing. Like I always tell patients, like our body has an amazing ability to heal if we give it the right environment. It's amazing. So it's just being able to spend the time with people to figure those things out. So tell us a little bit why you started private health.
As our healthcare system goes through, all the changes that have come about, not only over time, but as a result of COVID and the changes in our healthcare system, I knew very early on in my career that the typical doctor and the high volumes, it was not for me. I think there are certain doctors that, excel in that environment. I am not one of those. And for me, I like the personalized touch. I like being able to spend more time with my patients and getting to know them and their families. And for me to get, to provide the type of healthcare that I want to provide, I need more time. And traditional medicine really doesn't allow a financial or business structure that allows that. You've got to be very efficient, very quick, and be able to get a point across in a very short period of time. And that's just not the way I practice, and I'm not good at that. So for me, it was trying to be able to practice and provide medicine in a way that I was most comfortable, that worked best for, my life and my family. As I went through the different aspects of concierge medicine, it kind of has evolved just as kind of what I wanted to do for a career. And as you learn the environment, there are a whole continuum or spectrum of types of concierge medicine here in Dallas and across the country. And so for me, that vision had kind of evolved over time. And once I started practicing it, I quickly realized that there are benefits to multiple different facets of how you practice concierge medicine. And for me, it was really focusing on not just the preventative aspect, the diagnosis, but also the management, the long-term care, being able to provide care for multiple different family members, and being able to be personalized and not just be able to, it's nice when you're with a large healthcare system, they want you very cookie cutter, fit into a specific category. But in reality, patients don't always fit into one category and often, span across multiple different categories. And so for me, that's ultimately, once I kind of started practicing in the world of concierge, kind of got my vision as to what I wanted, and that's what I created.
Yeah. Well, I mean, I tell patients too, like, I don't know how you can figure out what's going on in a 10-minute conversation, because that's all you have. And half the time, even when you have that 10-minute conversation, you've got to ask questions to check off boxes for insurance so that you can make sure that you get paid for that 10-minute conversation. And even if you're like the best person you can multitask. I mean, I'm total ADHD and I could multitask, but at some point you do an in-service to your patients. I mean, I know when I was with the whole insurance side of things and doing stuff, I would get frustrated that a patient, I was on their 15th visit and I finally figured out what was going on, when if I actually had the time with them, it probably would have been their 4th visit. But when you have so many people that you're navigating to figure things out, you just are going to miss things. You just can't sit down and have the conversation. So when you can have these conversations, you can have the time with people, you are going to be able to save them so much heartache and long term, and sending them to this test and this test and this test because they don't have time to really deal with people.
Right.
So what else have you noticed? Like, I mean, because I think people see the frustration from the insurance side of things of them trying to see a doctor using their insurance, but like, I don't think people hear it from the medical providers, like what we all have to deal with. And a lot of times I know you hear all the time, well, doctors make so much money, so what's the deal? I'm like, you don't understand the half of it. They really don't in the system. It's gotten worse and they have no time, and their paperwork is like 3 hours a day now with all the new changes. So tell us a little bit about like some of the problems that you've seen within the healthcare system.
I was going to say, to be fair, I haven't been in the traditional healthcare system now for 8 years. But I hear from my colleagues, and I know the things that I endured are the things that, continue. One of the biggest things for, I think, physicians is the amount of time spent out of the office on, administrative tasks, paperwork, documentation, all the things that we love, me included. But that is an area in the traditional world where you may spend a typical provider maybe in the office from 8 to 5, spend 2 to 3 hours documenting at night. I don't think the average person realizes how much time is spent. And there's plenty of physicians, around the time that I started my own practice, I know several that did the same thing that failed. And you're kind of stuck. And most of the healthcare systems require very strict contracts and non-competes that kind of get you pigeonholed. And then, most doctors end up agreeing to something that they probably shouldn't agree to. The reason I don't, take insurance is because it is the amount of time and effort it takes as a individual practice to be able to deal with that is extraordinarily complicated, very time consuming, very frustrating. To get 36 cents back for XYZ charge from an insurance company or Medicare isn't really worth the time. When you look at, you're paying your attorneys to set up your practice, $500 to $600 an hour, yet Medicare is paying you $36 for a Medicare annual physical, or $86, whatever the number may be. It's crazy. But that's the reality. And I know whether it's in physical therapy or in most other fields in subspecialties of medicine, it's a similar issue. Surgical subspecialties, I think, get a little bit more for procedure based, but I know that they've been affected dramatically as well. And unfortunately for the average individual, as a patient in our healthcare system, I think patients as a whole are probably going to feel more and more lost, that they don't have a quarterback in our system. Yeah. The ability to deal with the bills is I don't even mean from the financial component, which is obviously an issue, but more importantly, just to actually understanding the basics of, what you're getting. I see the bills that I get for my own family, and they're fairly confusing when you're trying to understand them all. And unfortunately, we moved more towards a universal healthcare system for the United States. I think for the average provider, the amount of time that is going to be spent will probably be even less. The amount of time that the average person will actually see an actual doctor will be even less. There'll be ancillary providers, whether it be, nurses, nurse practitioners, physician assistants, or however, pharmacist with test to treat. You won't even see someone who's trained to technically take care of patients. And our system is moving more and more towards that. I don't see it necessarily changing, which is why I think the advantage of things like concierge medicine for those that can afford to be able to spend more quality time and to get personalized recommendations is helpful. I know for a large segment of the population, that's not feasible, but there are options that have come up in place that are different from the traditional medicine, something called direct primary care, which is also another option. And so all those options, depending on how patients want to divide up their own revenue and their own income from what they do and where they want to spend their healthcare dollars and how they want to spend their healthcare dollars, there's lots of different options. And I would encourage people to look at all the different ones. I know obviously my practice is not right for most. We charge a fairly hefty premium for what I do, but there are those that are a lot less expensive than what I do, and there's also those that are a lot more expensive than what I do. So I think as a patient, you have to be willing to kind of do that search as to what's right for you and your family and your loved ones. And just like for what you guys do, it offers a service and that patients can decide, is this something that I want to experience I'm going to have a better quality and a better understanding, and is that worth that additional cost to me? And then for each thing you look at in healthcare, our patients will have to decide those things.
Well, it's, I tell people too, sometimes it seems like there's an expense up front, but the amount of money that you're going to save and heartache is so much less. I mean, like, we can save people from getting unnecessary MRIs because honestly, they don't give me any information. I can do an evaluation unless there's some red flags or things like that. We can figure that out. Like, that's going to save you right there, saving you from having surgery. That's going to save you. And, when you go from doctor to doctor to doctor to doctor, because they don't have time to spend with you. And you've spent all this time in heartache when you could have just had some time with one person to start navigating that and being like you said, the quarterback.
Right.
And it's crazy because now I'm reading articles on artificial intelligence and how they're going to use all this. I'm like, that's all well and good. They're going to have apps for physical therapy exercises. I'm like, that's great, but is it a cookie cutter exercise? Are they really getting to the source of your problem? Probably not. And you're still going to be having issues. And now you're going to have less experienced people telling you what you need to do. So it comes down to, where do you want, our health, if we don't have health, we have nothing. It doesn't matter how much money you have, how little money you have. If you have no health and you're not living, you're not living.
Yeah. I was gonna say, with, it's always, and again, as a physician, I do this myself, but it's always, patients will call with the, I hurt my knee or my back, or a patient today who, injured their hip in yoga. And, the patient's asking to get x-rays. My staff's asking if I should get an MRI.
Yeah.
I'm like, well, the first thing is I probably just need to see the patient.
Yeah, exactly.
And so, initially I was thinking from what they were describing that they were describing that she heard a pop and a tear and it was on the anterior part of her thigh. So I'm thinking, X, Y, Z. And then when she gets in here, it's something totally different.
Yes.
And it turns out, it's a high hamstring injury. And so, until you've actually seen it, and a lot of times when I see an exam of the patient, I may not know the answer.
Yep.
But it's, things are lost in translation until you actually look and examine the patient yourself. I sometimes send patients to specialists and they can't come in the door unless they've got an MRI first.
I know, it's just so crazy to me, but.
Which I understand for some things, but it's the reality of where our healthcare system is at.
Yeah. I mean, one of the big things I talk about with my patients is that, like, we as healthcare providers, we see like one thing. So like you have knee pain, you only look at the knee, and that's all we're going to look at. And I'm like, could be a hip problem, could be a back problem. I mean, 71% of the leg issues usually comes from the back or the hip. There's nothing going on down there, but it's all coming from up top. And you've got to look at, like, how is everything moving? And getting down to kind of the source of it. I mean, it's crazy. Our body's connected. So if you image one body part, it may not be where everything's coming from. So yeah.
Right.
Well, give us some of your specialties. Like, who's your ideal customer that loves to work with you?
You mean from a patient perspective?
Mm-hmm.
I think probably patients in general that want to be kind of on the cutting edge and access to different things from a prevention standpoint that they wouldn't otherwise normally have access to. So a lot of the testing that we're going to do. So, let's say, for example, that your father had coronary disease and you want the XYZ latest and greatest and you're 40 years old as to what the different testing options are. Or you want someone that's going to take the time to talk to the specialist when you do have XYZ problems. Or you want to be able to, when you do get sick, is you have someone that, is interested and does love what they do. And even if it's, there's a lot of things obviously that I'm not an expert in a whole host of things, but I've got a broad spectrum of knowledge when it comes to primary care. And so trying to not send a patient who comes in with, 12 different complaints, the goal would not be to send them to 12 different specialists. That doesn't mean there aren't, if someone comes in and they've got a visual problem with their right eye, I'm going to send them to an eye doctor or an optometrist. There are certain things you have to know your limits.
Yeah.
But, someone who wants to be able to address not only all the things on prevention, but also being able to manage whatever medical problems they do have. Before I learned how to do the prevention aspect, which is not something you really learn in medical school, or at least not when I went through medical school. It's kind of nice to be able to do all the disease management and be able to apply that knowledge, but then also be able to focus on prevention and be able to know what to do when you do find abnormalities. A lot of times in the world of concierge and preventive medicine, the two don't align. So often, you can go to get some amazing physical at a facility, and yet you're given all these medical problems you have, but no answers.
Yep.
And then you're supposed to go back to your regular doctor who's like, well, I don't know what any of those things are, and I don't believe in that stuff. So then you're, as the patient, you're kind of stuck.
Yeah.
So I tried to I think for patients that want kind of the full package and really want someone that I think for anyone who's looking for concierge medicine, and a doctor in general, even whether it's concierge medicine or not, you want a physician or a provider who loves what they do, who has your best interest at heart, not the hospital system or the group that they work for, but they truly care about you and your family members, and that you trust. And you want a provider that you trust. You want someone that you can get a hold of. God forbid you need them for something that's more serious. And we're in a day and age where it can be a hard thing to find, but there are avenues to be able to find that throughout our healthcare system. So.
Yeah, I always tell people it's like we're the coach. We're coaching you through the whole entire process.
Right.
I mean, it's essentially what you're saying is like we're coaching you. It's like we get the information and then we're going to help you through the whole process, and going to, using insurance and seeing a medical doctor that way. There's no way, there's not enough time. I mean, I always think it's like, oh yeah, just go lose weight. Oh, great. Like how? Like I'm here to get advice and you're just telling me just go do this. And that's not going to really help me. I mean, it's kind of the same thing with like diseases or whatever. Like, what are some natural ways that I can help myself that I can do? And that's what you're going to be able to do and help.
For someone, when you're getting a routine physical at a doctor's office in general, when I was at the beginning of my career, the average allotted time was, I think, less than 15 minutes per patient. Now, I didn't do that myself, but the majority of my colleagues did. That's just the way that it works. And if you don't, your income, as you go back to your initial thing about doctors making so much money, and we had doctors that were actually making less than some of our administrative staff and our nurses because they didn't see enough patients in a day.
Yeah.
And so it really depends on how a physician practices and what the expectations are and what all is being tested on a patient. I think a lot of patients, until they've had a certain degree of exposure, I don't remember if it was a joke or something on a show that, you go in, you take a deep breath and how are you doing today? I'm doing great. And you get your blood work and you're out.
Yeah.
That is definitely not what I do. There's a fairly impressive battery of tests, but it is also, for certain people that have, someone's got a family history of X, or they've got a personal history of X, or they've had XYZ medical problems already with their spine. It alters what we do. And it's not the same test every year. There's certain basic ones, there's certain ones that are on XYZ schedule. So it really depends. It depends on what decade of life you're in. For someone who's in their 20s versus someone in their 50s and versus someone who's in their 80s are three very different types of tests that they're going to need. So.
Well, and I think people don't realize is that insurance literally only pays for 15 minutes of a doctor's time. So you can spend more, you're just not going to get paid for it.
Correct. It doesn't matter how let's say you have a patient coming with, 1,000 page medical records or 2,000 pages, and you spend 10 hours reviewing those records. I mean, there's ways to bill for it. It won't get paid, or it didn't used to. So you're just providing it for free.
Yeah. Yeah.
Out of the goodness of their heart. So.
Yeah. And I don't think people realize that at all. On our end, I always told people when I had an insurance-based clinic, it's like I was spending more money on people to help me get the 2 cents back from the insurance companies because they would deny things, even though you did everything correctly, you're just having to resend it in, than I would to spend money to help actual people coming into the office.
Right.
And it's so frustrating. And then the amount of phone calls that you have to get on for the insurance companies as a physical therapist, or doctor, to go and fight a claim that's been denied. I mean, it's like, are you kidding me? This is crazy.
Yeah, I still have to deal with it.
Yeah.
Dramatically less than I used to. But dealing with they always call them the peer-to-peer, where we have to try and get medicines approved that are not approved, or surgeries approved that are not approved. It's always interesting to hear the explanation on the other end. But anyway.
Yeah, it's crazy. It's like a waste of time. All they're going to do is deny you.
Yeah, it's definitely a time sink, and it's very frustrating.
Yeah. So if someone really wanted to work with you, I know you have pretty much a full practice, but if someone really wanted to work with you, how would they go about doing that?
So they could just go to our website. It's www.privatehealthdallas.com. And on that, there's a patient a link, and they can either call the office or they can send an email for the patient interest. The other option would be on that, there's the phone number, just call it practice. So any of those, we're kind of like a family here. I've had the same employees pretty much since we started. And that's pretty much it. We do have another physician who's going to be joining our space in October, who's also a concierge physician, who will be taking patients as well. It'll be a little bit different structure than the way I practice, but in general, still similar concept. I think that's it.
That'll be awesome. Well, thank you so much. This was so awesome. And it's always nice to hear from a doctor's point of view on why they set this up and what really is going on in healthcare, because I just don't think people really understand, it's just as bad on our side as it is on your side.
Yeah, I believe it. Well, thank you so much for having me, and have a good rest of the day.
You too.